Hey everybody, my name is Heller, and this is blog number 3. The skills I would use as a manager are motivation, communication, and setting priorities. In order to motivate the staff, I would keep them informed on what's going on in the organization, help keep them up to date with any changes that occur. I would also make sure to provide them with the adequate tools to make them successful in their jobs. I think proper communication is essential to successfully running a department. Through effective communication, I would use interpersonal skills to work as a team. By communicating well and working with the staff, that also helps reduce turnover. According to the leadership assessment that I performed, I scored moderate in administrative and interpersonal skills and very high in conceptual skills. So these are some areas that I can improve on, is the administrative and interpersonal skills. In my field, in the operating room, we use the AORN as our standard, the research-based, evidence-based practice. AORN is the Association of Perioperative Registered Nurses. They're considered the gold standard, and we get all of our guidelines in the operating room from the AORN. Whenever we want to change a policy in the OR, we first look to AORN for guidance. If they don't have a guideline for it, then we look to other facilities and see how they do things. In the operating room, we work with almost every department in the hospital, from the ED to ICUs to pre-op and PACU. Oftentimes we get patients directly from the units in the hospital, and sometimes they have to bypass the pre-op area and PACU and come straight to us. So we really have to work well with the whole rest of the hospital. The article I read was called Structured Nursing Communication on Interdisciplinary Acute Care Teams Improves Perception of Safety, Efficiency, Understanding of Care Plans, and Teamwork, as well as Job Satisfaction. It's a very long title, but it showed that by performing multidisciplinary rounds, the bedside report with all the different disciplines, instead of just the doctors, they were able to increase the not only patient satisfaction, but efficiency. They promoted teamwork, and it created an environment of safety. Issues were brought up to the doctors right away versus having to page them later on. The patient's concerns were addressed very quickly instead of waiting till later in the day till the doctors came around again. So it was very successful, the multidisciplinary rounds working together and solving problems right away. So it was a very interesting article. The structure that I prefer is the horizontal structure. That way it's more of an open dialogue and enhances communication between managers and the staff. The structure my facility uses, however, is kind of more of a vertical. There's not, some of the managers kind of claim to have the open door policy, but in actuality, it isn't really that much of an open door policy. So I feel like it is more of a vertical. The top down determines what happens, and they make the rules from the very top, not from the bottom, and not horizontal. I feel like they don't really give us explanations of why things happen in my organization, which that kind of it hinders communication. When people don't know why policies are being created, it tends to make people don't always jump on board with new policies if they don't know why things are happening. So that's kind of how my organization works, and I guess that finishes up this blog.